I would like to talk to you about Rectocele, what it is, how it happens, and what can be done. Rectocele is a type of pelvic organ prolapse. And if you remember, if you watched my video, pelvic organ prolapse is when the organs in your pelvis shift and start sliding through the vagina. So rectocele is one of the type of pelvic organ prolapse. It's located in the posterior wall of the vagina, so the wall between rectum and vagina. And the way how it happens, the support system between vagina and the rectum gets weaker and start protruding, bulging in the vagina. And by support system, I mean all our pelvic floor elements, such as muscles, ligaments, that helps to maintain our pelvic floor. There are certain risk factors that predisposing women to develop rectocele. Certain conditions, for example, Ehlers-Danlos. Some people have a weaker connective tissue and more likely to develop rectocele or other type of pelvic organ prolapse. There are also physiologic factors, for example, chronic constipation, when you spend a long time in the bathroom pushing down trying to have a bowel movement. Chronic cough, when you're always coughing and it increases your abdominal pressure. Heavy lifting for a prolonged period of time can also do that. And one of the most common reasons for women to develop rectocele is to have a vaginal delivery. When the baby goes through the birthing canal, it stretches the muscles, the support system, and that posterior wall gets affected the most. Majority of women get stitched up during the delivery or get healed afterwards. But that imperfect connection of the support system underneath the vaginal skin with time start getting weaker and women develop the rectocele. Most of the women do not have symptoms of rectocele. They learn about having that condition only when the doctor, like gynecologist, tells them, hey, you do have a rectocele. In those cases, if there is no symptoms and you're not bothered by anything, there is no really reason to address that. Rectocele, as any other pelvic organ prolapse, only needed to be treated if it's causing you symptoms, if you're uncomfortable. If you have a rectocele but it's not bothering you, there is no really reason to treat it because it doesn't put your life in danger and it doesn't compromise your overall health. But if you have symptoms, there are an option for addressing the rectocele. What symptoms might someone have if they have a rectocele? You may feel the fullness in the vagina, feeling of heaviness, and one of the most common symptoms is the feeling of the bulge in the vagina when you're trying to have a bowel movement. And actually, sometimes you're finding yourself putting your fingers inside of the vagina, pushing on that posterior wall. This maneuver called splinting, when you manually help yourself to have a bowel movement. In that case, again, if it's bothering you, we can help. And what are the options? I will start with least invasive to the most invasive, but it doesn't mean that every person needs to go through all the options. You can pick and choose which option works for you and for your lifestyle. One of the first treatment options is the pelvic floor physical therapy. Pelvic PT not gonna put that support system back in place, but it can help the symptoms that you're experiencing. It can also help you learn how to have a bowel movement in a right way. And when you do pelvic PT along with the biofeedback, it can help sync your pelvic floor muscle and your mind better, so your bowel movement are more efficient and there is less strain on the pelvic floor. Another option is the pessary. But the problem with that option is that there is no ideal pessary to help with rectocele. The reason for it is rectocele is located very close to the vaginal opening, and it's very difficult to put a pessary the way that it will prevent that bulging of rectocele, because pessary usually placed higher up in the vagina. Another treatment option is the surgical correction. The procedure to fix rectocele called rectocele repair or posterior repair, because it's a posterior wall of the vagina. If rectocele repair is the only procedure that's done, it usually takes about 40 minutes to an hour to perform, and it's an outpatient procedure. If rectocele repair is done as a part of the larger reconstruction involving other organs, then it can take longer and sometimes require hospital stay. So in terms of post-op recovery, there are three main things to keep in mind. First, make sure to avoid constipation. Keep your bowels soft and regular, and Miralax can help with that. Second, avoid strenuous physical activity or heavy lifting to allow the tissue to heal. And the third thing, avoid placing anything inside the vagina, such as tampons, vibrators, or having sex for about 4 to 6 weeks until sutures are healing. You might be thinking, what if I'm not going to treat a rectocele? What will happen? Well, if you don't have any symptoms and you have normal bowel movements, nothing's going to happen. You don't really need to treat it. If you have symptoms like difficulty having a bowel movement, those symptoms can get progressively worse. Rectocele, the issue of posterior wall of the vagina, is a very common condition, especially for women who had given birth vaginally. For some people, it can be asymptomatic and nothing needs to be done. But if you experience symptoms of the rectocele issue with having your bowel movements or discomfort with sexual activity, it's definitely worthwhile to seeing your urogynecologist and consider repairing your rectocele to improve the quality of your life.